Hi, my name's Dr. Amir Khan and I want to talk to you about the long-term symptoms of the coronavirus. Now, many of us know about the acute or short-term symptoms of the virus. These are a new persistent cough, a temperature or fever, or an acute or sudden loss in your sense of smell or taste. But what we're learning as time goes on is that the coronavirus can actually affect people in the long term and give them long-term symptoms. These people are now being called the COVID long haulers. And what's interesting is that some of them have only had mild symptoms of the coronavirus and weren't admitted to hospital, yet they have still had these long haul symptoms. So the severity of the acute infection doesn't necessarily correlate with you having long-term symptoms or not. So let's talk about some of these symptoms. Headaches. Chronic headaches is a big part of what people are complaining about, but also depression, anxiety, and even confusion and long-term tiredness or chronic fatigue. Down in the nasal area, people are complaining that their sense of smell and taste hasn't returned 4 to 8 weeks later and are going many months without a sense of smell coming back, which is then affecting their taste. Down in the lungs, we've had lots of people complain about a chronic cough. That's a cough that continues long after the infection itself has cleared up, and getting short of breath just doing small day-to-day things. Some people have even been diagnosed with a condition called pulmonary fibrosis after the coronavirus. This is where the lining of the lungs harden up and it makes it very difficult to breathe, and they can become very short of breath. People have also described heart symptoms, chest tightness, chest pain, but also inflammation of the heart lining, a condition known as myocarditis. And some people have gone on to develop heart failure as well. Down in the abdomen, people are reporting symptoms of diarrhea, which can go on and on and on, but also problems with the liver function and the function of the kidney. So that can be really serious. In the nervous system, people are reporting chronic long-term nerve pain. That's burning pain, shooting pain, that kind of thing. And also skin rashes are developing on people with coronavirus in the long term. It's not just that though, it can cause problems with your blood, specifically around clotting. It can increase your chances of developing clots and having things like a heart attack, a stroke, or a clot in the lungs. So it is really important that we try and reduce our risk of getting the coronavirus, and we can do this by socially distancing, washing our hands regularly and for 20 seconds, and wearing a mask where it's appropriate. Even though this won't stop your chances completely of getting coronavirus, it will minimize them. And just remember, even if you get mild or no symptoms from the acute infection, you may well suffer long-term complications. So it's really important we protect ourselves.